Welcome, everyone, and thanks so much for joining us on the Flourishing Life podcast, where we will be discussing what we see on the daily. We're Jackie and Tad from Flourish Medical and Wellness in Savage, Minnesota, where listening to our patients is the priority. Our foundational medicine clinic bridges the gap between traditional and functional medicine. We are pattern recognition specialists that focus on individualized patient care and health optimization. With a combined 30 years of medical experience, our goal is to provide insights that help you take control of your health. Be sure to follow us on Instagram at Flourish Medical Wellness and on our website, flourishmedicalwellness.com, to stay up to date with what's happening at the clinic. The following content is the opinion of Jackie and Tad Tewes and is not intended to diagnose or treat any medical conditions. Be sure to speak to your healthcare provider for your unique health needs. Hello, everyone. Welcome back to the Flourishing Life podcast. Tad and Jackie here from Flourish Medical and Wellness, where our priority is listening to you, our patients, and practicing a team approach to foundational wellness for long-term healing. We are super excited to begin our new podcast season with what we see on the daily. So this is the first episode on that, and it's going to be fun.
Yes, this gives you guys the inside scoop, and it'll be a lot of fun just to talk through what we see commonly, and then also a lot of the questions that we get.
Yeah, so it'll be a little more entertaining, hopefully. And patient stories, kind of just a little inside look at what it looks like here.
Absolutely.
Okay, do you want to start or you want me to start?
Why don't you start this one?
Okay. So one thing that stood out to me in the last few weeks was a patient who had come in and they were seeing their primary care provider for just a regular physical, and they had checked a TSH and then gave recommendations to the patient about how they needed to change their thyroid medication dosing based specifically and only on a TSH. And so that's something where I asked, how did they do other labs? Did they check a T3, a T4 to give you more specific direction? And they hadn't done that. So I think this is a common thing. I don't know if you hear it a lot.
Absolutely, yeah, and it's commonplace for just a TSH to be checked. So what people need to know who are listening is TSH, or thyroid stimulating hormone, is that hormone that's made by the pituitary in the brain. It's sent down to the thyroid gland in people's neck to tell it, hey, make thyroid hormone. But it is not a specific thyroid hormone. It's a messenger hormone. And so when we get just a TSH, then it doesn't give us the whole picture of what's actually going on with circulating thyroid hormones. And, a savvy person would then say, well, why do we only get a TSH test? Why do we only get a TSH test, Jackie?
That's a great question. And I do get this question a lot. And I have that question. Why is that how we were trained? Like, that was how we were trained, to only check a TSH and sometimes a T4 as what's called a reflex. But the reason for that, I think, where this stems from, is that's what insurance covers. And so that's what we're going to check most commonly, most frequently. And it's how we were trained to check the thyroid, but we're missing the full picture.
100%. And it's the equivalent to doing the bare minimum possible.
Yeah.
This is like when you ask your teenager to go clean her room, and we have a little experience with this, and you walk in there and things have been shoved into a corner, shoved into a closet within 2 minutes, and it's like, okay, I did the bare minimum, we're good.
Yeah. So I guess takeaway, if you are on a thyroid replacement of some sort, or you have hypothyroidism or even hyper, we need to know a TSH, a free T3, and a free T4 at minimum. So that's something to be requesting from your provider if that's not happening.
Yes, and then other thyroid tests like reverse T3 and then thyroid antibodies, both thyroglobulin and thyroid peroxidase antibodies. Those can be used in certain people, especially people with a history of Hashimoto's. Very valuable there, but minimum are the three, like you said.
Yeah. Okay, next case. Super cool story, and this is not the first time that I've seen this, and so wanted to kind of talk through this a little bit. I had a patient, hairdresser, so a lot of exposure to toxins on a daily basis, just different chemicals. And even before coming in to see me, she was on some GLPs and had really plateaued. She had lost a little bit of weight to begin with, but was completely stuck. So of course we dug into nutrition, what was she eating and all of that. And nothing changed. She was really stuck. And so we started her on a detox.
Yeah.
So she had lost 20 pounds. When I saw her back, I think it was maybe 8 weeks later, 6-8 weeks later, just from starting the detox. So nothing else was being done differently.
Wow. That is incredible. And it really speaks to like kidney function, liver function, and how much metabolism is affected by those.
Yeah, so, toxins, our body's smart. It was created very, very well. In that if we have a lot of toxin load, your body's going to store those toxins in the fat. Toxins are fat soluble is what we call that. And so it's a protective mechanism to try and make those toxins create less havoc on the body. And so it stores them in the fat. And then a lot of times that's what we see. If there's a weight loss plateau or weight loss resistance, you can't ignore the toxin piece.
Absolutely. Well, and will you say or speak to how long toxins last since they are fat soluble?
It can be forever. So there's no magic time frame. Like, if I just avoid it for this long, it'll go away on its own. I mean, maybe some will, but not always. Yeah, sometimes your body needs help getting rid of those.
Yeah, absolutely.
And that's so common for hairdressers. That's a common one that I see. Do you have any other patients in like commonly high toxic work environments?
Absolutely. Any manufacturing where there are things being aerosolized, really, really common. Flooring can be part of that too, especially flooring production with things like carpet, laminate, those types of situations as well, especially if the appropriate PPE is not being used.
I think the other one I see too is like home builders, even interior designers, like they're in the paint, the carpet fumes, all of that too. It's a common one.
You good if we pivot for a little bit?
Let's go. Let's hear it.
So one thing that I've been hearing a lot lately in clinic is, I'm in this rut. How do I get out of this rut? And this is super common this time of year. We get toward the tail end of January, toward the beginning of February. Usually people have a little bit of a push beginning of January with New Year's resolutions, but then when things fall off, there can be a rut in terms of habits. And that can be eating habits, exercise habits, sleep hygiene falling off, alcohol intake increasing, any combination of those. But what are some strategies that you've seen when people do start falling back into bad habits in any of those areas?
I think it's always, to me, starting small.
Yeah.
I think it's so important to kind of pick one area that you need to improve on, whether that's getting to bed on time, whether that's being more active. I just find in our world, everyone is so overworked and overstressed that if we try to be like, okay, let's get back on track and do this, this, and this, and this, it's just more overwhelming. Yeah. And so picking one thing and doing that every single day consistently for 21 days and then build from there.
Yeah, and establishing that habit over 21 days is key. It's funny, you took it right off my notes. I said stepwise, so taking one area, let's focus on eating habits, or let's specifically focus on not snacking after dinner at night, or sticking with that intermittent fasting, that eating window we had talked about with a focus on whole foods, just that. And then also having the accountability in too. I don't know if you do this, but I have some people, they send me a portal message once or twice a week as kind of an accountability check-in, just saying, hey, I'm doing well, this is what we had talked about, this is what I'm doing, just checking in with you. And that does seem to be an added layer that leads to better results for some.
Yeah, and also just leaving them from your visit, say, hey, when you come back next time, we're going to talk about this. And I think a really easy, free, very commonly overlooked tool is journaling.
Absolutely.
There's so much we don't even realize that we're doing or not doing until we actually take the time to write it down. It doesn't have to be, a 20-minute thing. It could literally just be jotting it down on your calendar or in your notes app on your phone. I, hit my eating window this today, or I didn't. And then just going back and seeing, because I think when we get caught up in the day-to-day stuff, you forget what you did or didn't do.
Yeah.
And so just literally jotting it down, I think, is such a useful tool.
Yeah. Have you seen a lot of power in serial body composition scans or serial in-body scans?
For sure.
Yeah. It's kind of a loaded question.
Yeah. I mean, how would you not? I think I would say most times people are surprised, either oh, wow, I worked really hard and I feel like I was going to see more changes. Well, what did you work really hard on, right? Because that's great. That doesn't mean that was a bad thing, but did you also do the protein? You lifted more. Were you actually giving your body the nutrients to help build the muscle? So, I mean, I don't know how you would have an effective weight loss program or plan without tracking those things.
Yeah. Well, and the feedback too, like you said, if we put a system in place and it's going well and we're seeing minimal results or things not as quickly, that tells us, hey, we really need to dig into this. There's something that we should be tweaking.
Yeah, and I think for me, what I've been seeing in this first kind of month of the new year is a win is not seeing it get worse. Like if we're just keeping it stable, like we won. So, now let's go.
I always tell people in December, play for the tie.
Yeah.
You may not make a ton of progress, but let's stick even through the holidays and we'll have a good starting point.
Totally.
One other thing that I've been getting a lot of questions about is peptides, and it's GLP-1s, it's growth hormone peptides, and there are a myriad of peptides that people have access to online now too. But we should speak to the ones that we commonly use, and then also some of the regulations surrounding them too. So the big ones that we use commonly on a day-to-day basis are going to be GLP-1s, semaglutide, tirzepatide. There is a newer one coming out called retatrutide, which is still considered experimental, so we're not able to get those through vetted compounding pharmacies. They are not supposed to be compounding that. People do have access to retatrutide online, but be careful because the vial's probably going to say for research purposes only, not for human consumption. That's the disclaimer.
That's a huge piece in and of itself. There's like the whole peptide world, again, so much noise around that right now, and like what's true, what's not, what's safe, what isn't. But research only peptides, I personally would steer clear of.
For sure. Well, especially when we get the results with a medication like tirzepatide, when it's used the appropriate way. And once we have a little more long-term data or longer-term data on retatrutide, then I think there will be more safety to it. But at the same time, protecting people, that comes before the minimal increased efficacy that's potentially there from retatrutide compared to tirzepatide.
Yeah, and I mean, that's something we stand by here. Like we are not hop on the new and upcoming bandwagon as soon as it comes out. We are make sure it works, make sure it's safe, make sure that, for the majority of people that we see, it's going to be appropriate. So that's, I think we do a really good job at that. And then also, would we do it? Like if it's something that you and I wouldn't even take or touch personally, we're not going to recommend it.
Absolutely. Well, and that's an important point to make is both you and I microdose tirzepatide, both you and I use NAD, subcutaneous injectable NAD, because of the efficacy, because of the safety profile, and when those are used the right way, they can have significant positive effects for people. Obviously, if you get the dosing wrong, if you get it from a bad source, there absolutely can be some negative outcomes.
Yeah. The other ones we use, Smorelin. I like Smorelin. I've been using it more. I personally have started using it and have seen pretty incredible changes as far as sleep, energy the next day, workouts. I would say I've seen a change in my just body composition. You've probably noticed that too.
For sure.
Like muscle mass.
Absolutely.
You come in the other day, you're like, wow, look at those guns.
Yeah, you get strong. You're going to start using the same dumbbells I'm using.
So I've liked that one. I think it's been good. I've had some good patient success with that too.
Love it. Two other ones that we should just mention in passing, BPC 157, body protective compound, a very good anti-inflammatory peptide. I really like using that combined with KPV, which is a tripeptide, mainly for gut health. When you use it in that oral form in a capsule, it gets great anti-inflammatory benefit, not only in the GI tract, but also systemically. And then GHKCU is another good one, copper peptide, and that can be used either in capsule form or topically.
Yeah, I have seen a ton of great results with BPC KPV. Yeah. Gut health, again, joints even, really helping with inflammation and overall joint pain and recovery. So I have several patients who really, really love that one. Yeah,
and one group I should mention when it comes to BPC 157 is inflammatory bowel disease. When we're thinking Crohn's, ulcerative colitis, BPC 157 can be a game changer for some of those patients. And typically those are people who need to be on an immunomodulator anyway, and being able to utilize peptides, which are naturally occurring compounds, can be a nice additive benefit to the immunomodulator or antibody therapy.
So let's back up a little bit. Let's talk exactly what is a peptide, because I think a lot of people don't know this. So peptides are naturally occurring substances that our body makes. Broken down to like the most simple form, what that means is a chain of amino acids that's less than 100 long, versus a protein is more than 100 amino acid chain. So it's just literally the difference in the number of amino acids that are attached, and they work as signaling molecules. So they signal something to happen in the body.
Exactly, yeah. Small, naturally occurring signaling molecules that are made of amino acids.
Cool. I saw a lot of this lately, and actually had one of our providers had mentioned this too. So the provider had reached out and was like, holy moly, I just had a woman come back who we started on some testosterone cream, and her testosterone was at 578.
That is not good.
That's a really high from some creams. Of course, we made sure like we didn't draw through where she had applied it and all that kind of stuff. But it was a really like aha, eye-opening moment for her, because she'd also had patients recently where their testosterone didn't move. And so it's just, I think there's a lot of, again, noise out there about creams, pellets, like how that creams are more controllable. Like you can control them easier compared to a pellet testosterone replacement. I personally don't find that to be so. And this is a really great example of that, where you can have some, one woman who doesn't absorb at all because it can't get through the skin barrier, and then this super high level and super highly absorbable. So I thought that was really interesting.
Yeah.
Do you have a preference that you find one or the other easier to control, pellets versus creams?
Creams can be tough. Creams can be a good fit in the right person, and that person has to reliably be applying that cream the right way to the right area at the right time on a daily basis. So there is a compliance part there, and there have been some nice studies that have come out that have shown the vast majority of people who start a topical hormone cream will discontinue it within the first year, and the reason being it's inconvenient. The second is there is so much variability with absorption through the skin, like you said, and we can't tell that just looking at a person. That same dose of, let's say, 0.25 grams for a female, maybe it gets her testosterone to go up 10 points, maybe it gets her testosterone to go up 200 points. And we don't know that just looking at that individual. That's why we need to get the follow-up lab test to see exactly what that person's absorption is transdermally.
Yeah. So how do you compare that with your experience with pellets?
Pellets are a lot easier.
Yeah.
Just once you understand the dosing, and erring on the conservative side, saying we're going to start low, we're going to go slow, and then we can increase that dose over time. And then also understanding what are called pharmacokinetics. How do these consistently give off that hormone into the bloodstream, and how long are they going to last? And part of that comes down to cardiovascular output.
Yeah. I mean, I personally obviously use pellets, and I also feel like I can control it a little bit better with my patients.
Yeah.
I think the big kind of pushback that we'll sometimes hear, not necessarily from our patients, but from what other people are telling our patients is, well, we can't control it, and once it's in, which not really. I mean, yes, once it's in, but that's why, we start low, we can always add, right? Yeah. So that's always the best rule of thumb, like start low, we can put more in if we need to. But for the most part, I feel like 95% of the time, their levels rise to where we're wanting that to.
Yeah.
I just feel like I can more consistently see that, get to that number of what I'm shooting for than I do with creams.
Absolutely. And I look at patient satisfaction too. Patient satisfaction on pellets here is over 95%. Mm-hmm. So there's something to be said for that. And then, people who will try creams, let's say they pelleted, they try creams, the vast majority go back to pellets.
I had a patient once who was like, I'm not doing pellets, like very first, because I was seeing her husband previously, mm-hmm. and then he finally talked her into coming. She's like, no matter what you tell me, I'm not doing pellets. I'm like, that's totally fine. You don't need to. I'm still going to talk to you about it and explain the different options and why. And we explained like the process of creams and daily and making sure you're washing the sink. And she's like, okay, never mind. I want pellets.
I wouldn't do creams.
It's just so much more work.
Yeah. Mornings are busy enough. Let's talk about low energy this time of year. So this time of year, very, very common for us to hear, I just don't have the energy that I had 4 months ago, 6 months ago. My ambition is down. I feel like my mood is a little bit down. How do you work that up? And what are some of those questions that you talk with people when they present with that?
Yeah, I mean, that's why we do labs, right? Because that's such a wide topic. It could be, are you sleeping? Do you have sleep apnea? Are you eating enough? Are you eating too high of carbs? What is happening with your blood sugars? Do you have low iron? Like, energy could be 500 things, right? So I think the labs kind of help guide us. If they are super low iron, then obviously we need to address that and then circle back and see if they're still tired. But the hard thing is that it can be multiple things. Like, there might not just be one issue. Like, maybe we get your iron optimal, your vitamin D optimal, your B12 optimal, and you're still really tired because you have a super high stress job, and we need to help your adrenals.
Yeah, absolutely. And I appreciate you talking about the common players, B12, vitamin D, iron stores, ferritin, also making sure that thyroid is still where it should be. Thyroid is such a huge regulator hormone, so important for energy and metabolism, and then hormones as well. Those are kind of the big pieces that I think about with energy on labs, but also as we get shorter days, as it gets cold here in the upper Midwest, people's inability to get outside and have activity. And if you don't have a plan for that, to say, oh, I'm not going to be able to get outside maybe for weeks at a time, what am I going to do for activity? What am I going to do to get a little bit of sunlight? And if we don't have a plan for that, it can lead to some negative outcomes this time of year.
Yeah. All right, another one. Can I go?
Yeah, absolutely.
I had another patient that really stood out to me in the last couple of weeks. So it was a 39-year-old female, and she was coming in, I think it was a repeat pelleting, and she was like really distraught, like significantly distraught. So she had been in to see her primary care provider for just a regular routine physical, and was kind of talking, she was asking her questions, like what she was doing, and she had mentioned hormones and all of that. And the provider said, I wrote this down specifically because I didn't want to forget it, you're 39, why would your hormones be low? You don't need hormones.
Was she tested for hormones?
No, and then she refused to check any levels for her. And she also was really pushing vaccines, and like, my heart broke for her because she, like, first of all was like, oh my gosh, am I doing something bad? Like, questioning everything, but then also feeling super uncomfortable and like pushed into a corner and almost attacked. Like, this is literally what she told me. And I was just, it's so hard to see that. Like, our priority should always be, if you're in this type of role, that's your job.
Yeah.
To listen to the patient, right? Like, what are they saying, and not just like come at them aggressively with what you think should be happening.
Well, and there's two parts to it. I think you're exactly right in that, number one, if we're going to tell someone that a level is off or something is not functioning,
or it shouldn't be,
shouldn't be, there's always a little bit of truth in a mistruth, right? In a highly functional 39-year-old female, could you stretch into saying that? Maybe, but you should at least have some evidence for the assertions that you're making to a person. And the second piece is, in our role as healthcare providers, our words, they matter, and people really, we need to be very careful with how we address people, because words can be intimidating. Words can really push people in one direction. So there's a responsibility there for all of us who are in this type of a position.
Yeah. So I think my big takeaway from that, after kind of calming her down and just being like, hey, let's talk through things, like just making her feel better about her life and her choices. And like, it took a little bit, but to empower patients to, I told her, like, if you're in that position again, get up and walk out. You are paying that person to see you. And if you're going to feel that way, leave, right? Like that is you can do that. And I encouraged her to speak up and maybe even leave a review or even call the clinic, because if that provider's treating her that way, probably treating other people that way. And so if we don't speak up, there's a lot more, higher chance that other people are being treated that way too. So it's not just about yourself, but it's also kind of advocating for other people. And I think that's so important, because I think we're transitioning out of this time now, but for so long, the role of a medical provider, a doctor, physician assistant, like PA, NP, whatever, it's been more of a dictatorship. Like, you come see me, I'm going to tell you what you must do or not do, right? And no collaboration whatsoever. And I think we're seeing a shift there, but we're still kind of pre-programmed in that dictatorship relationship, because it was like that for so long. And so I think just empowering patients to speak up and know that they have a say.
And it's a great transition out of that too, because now it is informed mutual decision making, or at least that's the way it should be. That's what we work toward, is well-informed decision making, because the person who's going to be executing that plan is the individual coming in, the patient, the client, and they need to be on board with that. What we know is that if someone is just told to do something and there's not a buy-in from that individual, compliance drops way off, their potential results drop way off. So it needs to be a team decision.
Yeah. And not scare tactics.
Not scare tactics.
We have way too many of those in our world.
Not good. All right. One other thing. I've been hearing the question a lot. How do I maintain muscle while I am losing weight? What are those strategies? Because I don't want to lose my muscle. I need to lose some weight. I want to lose some weight, but I don't want to lose this. What do you think?
I think it's individual. First of all, there's no one size fits all recommendation. It looks at, are you lifting weights? How often? How heavy? Are you hitting your protein goals? That's a big one. And then there can be some other tools like Samorlin or things like that you can add in. Do you find that varies with men versus women?
Absolutely. Yeah, leaner women or more petite women are that group where we really have to pay attention to the details with maintaining muscle through weight loss, because their bodies are set up to go after muscle as that fuel source as there's weight loss or anytime they're in a caloric deficit. So ideally, we're utilizing some level of testosterone for hormone therapy, potentially estrogen as well, depending on their native estrogen production. We can look to things like Samorlin as well, but heavy resistance training, getting those protein goals in, staying well hydrated, and potentially using supplemental amino acids like a perfect amino product. I really like the tablets because we can utilize those without breaking a fast. And so that's a nice add-in, especially for those people who are at the highest risk for losing muscle during weight loss.
Yeah, I do think it is a very commonly touted, especially on social media, like GLPs, you're going to lose muscle. 50% of that or more is muscle. It's not true.
No,
at least not in our patients.
We've seen people lose 30 plus pounds and not lose a pound of muscle, which is atypical compared to national averages. That's atypical. But if we put the right plan in place, if there's accountability and we monitor body composition through that process, we should be able to maintain as much muscle as humanly possible. It just, there has to be the right plan and the right follow-up there. This online GLP-1 garbage, it leads to so many people losing muscle, being in a bad metabolic situation, and then being stuck on a GLP-1 for years or decades.
Yeah. So I guess my kind of takeaways there are, yes, it can happen. It doesn't always happen. And here I would say it is definitely not the norm with our patients, that muscle loss, because we are paying such close attention and providing a specific individualized plan for that person.
Absolutely. You're up.
All right, I'm up. Fun story, and I think I shared this with you the other day. So I had a patient who literally came back. I think it's been like 6 months. It's been quite a while, but maybe even 4 months. the only thing she had changed was getting on her vibration plate.
Yes.
For 20 minutes a day.
This is great.
That's it. Nothing else changed. And she was down a pant size, a whole pant size. Jeans fit, but her A1C was down, like, it was down. It was much better too. So I was like, that is really amazing. Vibration plate. So
yeah.
What do you know about vibration plates? Do you want to share our vibration plate story?
I think vibration plates are a really useful tool for stimulating muscles and also detox pathways. Those are the two areas that I think they can be really helpful on. And it is super easy to use them too. You know, you and me, we just hop on the vibration plate, set the timer, and I mean, you can be reading something. You could be reading the Bible. You could be watching or listening to a podcast, watching, you know, some type of presentation, any of that. It just requires you to stand there and the vibration plate does the rest.
Do you want to share a story about how we got into the vibration plate?
So at the A4M conference, the American Association for Anti-Aging Medicine, we were looking at all the vendors, as you know, walking up and down that huge exhibition hall, and we got flagged down for a vibration plate. Someone who I was walking with got glittery object syndrome and decided to hop on and get me on a vibration plate, and before we knew it, we were buying a vibration plate.
Okay, but let's share this story. Okay, so I didn't just like hop on board willy-nilly because I want to know if something actually works. So you had a response as we were both standing on them. You had a response.
I did.
What was that?
So I had like itchiness on my sides with the vibration plate.
Yeah.
And that was something that I had never really felt before. It's pretty odd.
And I did not.
Yes, you did.
And you're like, are you itchy? I'm like, no, I'm not itchy. That's weird. And then the gentleman who ultimately sold us the vibration plate came over and was like, and you asked, like, I'm itchy. Is that a normal response? And do you remember his question to you?
He said, did you have any alcohol last night? And I said, yes, I had a glass of wine with steak.
Yeah, and I didn't have alcohol. And so I was like, all right, I'm sold. Like, obviously this is doing something. Like, you're itchy, you had alcohol. He knew that without us telling him, and I didn't, and I'm not itchy. So detox is a real deal.
Yeah, and the detox pathway thing is real. That's something that just regular use of that, I think utilizing that with like a detox protocol like what you're going to talk about can be such a nice addition to that.
Yeah. So what we've talked about it a little bit, maybe bringing a vibration plate here for people to use.
Yeah.
We'll see if you're interested and you would use it. Message us, comment, give us a reason to do it.
What else you got?
Okay, I only have one more interesting case study from the last couple weeks. Again, I feel like I get these like just heartbreaking people all the time, but menopausal woman, and she had been kind of in this perimenopause, late perimenopause, menopause transition for a few years, and her biggest symptom was like depression. She was just feeling really, really, really depressed. And so she had been in and out with psychology, psychiatry. They had put her on 8 different medications. So they kind of put her on something, didn't work, put her on something else, didn't work, put her on something else, didn't work. So like this 8, like that's a lot, right? And then finally, it was recommended that she start on some ketamine. And so for the depression to try and, because it was pretty severe. And so they put her on the ketamine. She ended up being overdosed on ketamine and ended up being hospitalized because now they diagnosed it as a hypomania state. And so basically overdosed on ketamine. So now she was too high and almost in a manic phase. And so then they had to hospitalize her and put her on lithium to bring her down so she wasn't manic, which then she gained like 30 pounds. So then she was put on Lybalvi, I believe is the name of it, to basically to treat the side effects of her lithium and to help with the weight gain so she's not as hungry and eating more, because that's what lithium does. And so this was like, I just again felt so bad for her. So first she goes through like 8 different medications for this depression and mood changes, which I really believe are mostly hormonal and perimenopause and menopause related, because it lines up timing wise. And then we just kept putting her on medications and then had to treat her with more medications to treat the side effects of other medications.
Yeah, well, and it speaks to what happens if you just treat symptoms and you don't actually get to the root cause.
Yeah, so I mean, this is not necessarily surprising to me. I think it felt, I was just so mind blown by this. And I think it's because I've been out of that world for a little bit longer now, and we don't see that a lot. But you know, when I was in traditional medicine, like that was common practice. Like, oh, you're having sexual side effects from your antidepressant, so we're going to put you on something to help combat that. And it was just this constant, we're going to treat your side effect from the medication with another medication. Yeah. And there you have polypharmacy.
Yeah, absolutely. And I mean, the gold standard, and you probably talk with this with your clients as well, is if we can get the body functioning as optimally as possible, hopefully you don't have to take any prescription medications for a long time. You know, that's the gold standard.
We were listening to a podcast once. Do you remember this, where they were talking about the number of prescription medications that someone is on directly correlates with how much sooner they'll die?
Correct. Yeah, and actually I think it was Gary Brecka who had said that in one of his podcasts, and that was when he was doing longevity research for the insurance world.
Yeah.
Because you know,
right.
Insurance makes their money based on determining how long is this person going to live, or at least that's part of the insurance industry.
Yeah, so his job, correct me if I'm wrong, but if I remember correctly, his job was to identify potentially how long this person would live. And so they did, part of what they looked at was just strictly the number of prescription medications they were on, because the more they were on, the fewer years they would live.
Yeah. Prescription medications, surgical procedures, isolation, those are all big factors.
Okay, you got more?
I don't. I want to get into the big wins.
Okay, that's what I want too.
This is my new favorite section.
So we have, so those are kind of what happened this month in clinic, and then we're going to do a monthly wins section, so big wins from our patients.
Love it. All right, I'll read mine. That'll be good. All right, first is a woman in her 50s. She has been on tirzepatide weekly. We've optimized her hormones, we've optimized her thyroid function, and addressed her eating habits. As of when I just saw her a week ago, she's down 42 pounds. She's down 10% in her body fat. And she told me at that visit, I feel like a completely different woman. Her hemoglobin A1C, average blood sugar, went from 8.2 down to 6.2.
Wow.
So she went from being well into that type 2 diabetic range down to prediabetes, and our goal is to get her out of prediabetes within the next 4 to 6 months.
So this, like, that is majorly life-changing stuff right there.
Oh, cardiovascular risk went down so much.
That's awesome.
Yeah. All right, next. A guy in his upper 40s, we are utilizing testosterone, improving his thyroid health. We did a whole overhaul on his eating habits. We did tweak his workouts a little bit. He is down 20 pounds now, and this is the first time he has ever been under 10% body fat, which was one of his goals. So, like, getting to that point where he's in great shape.
Under 10%
Under
body
10% body fat.
Wow, he must be putting the work in too.
He is. And the cool part is, he's a guy who's exceedingly coachable. So when we get those serial in-body scans and say, okay, we need to tweak up this just to make sure, and then also being open to variability so his body doesn't start to acclimate to certain things. So he gets the best results possible.
Cool.
Next, a woman in her lower 40s. We adjusted eating habits, optimized her thyroid. We really looked into sleep hygiene for her. That was huge. And then also optimized hormones. She told me, this is probably 2-3 weeks ago, this is the first time in years I haven't had daily joint pain. I can actually recover from my workouts and not be in pain for 2 to 3 days.
Nice.
That was a big deal for her.
Yeah.
But wait, there's more.
Oh, okay.
Pretty fun one. A guy in his upper 40s. We worked with adjusting his eating and exercise patterns, really improving his morning routine. His morning routine was really bad. Just sugar, lots of sugar, lots of cream, some coffee mixed in. He called it coffee. It's not coffee. It was a coffee dessert, basically, at that.
Cream with a splash of coffee.
Coffee.
Yeah.
Addressing his low testosterone, that was pretty low. Suboptimal thyroid function, that is improving. We're getting there. This was the cool thing. He owns his own business. He said 2025 was by far the best year my company has had, and this was a big part of it. So that was a huge deal for him in terms of just his function, his ability to lead, and his confidence too.
That's awesome.
That was a nice piece.
That's what I think we forget and we overlook so much, is that when we're living in this like funk of just trying to survive and get by, it doesn't just impact our health.
Yeah. It
impacts our family, our spouse, our work, our coworkers, our team, like everyone.
Yeah. Well, and that's where it matters. This is something where if we just go to our training and book knowledge and say, oh, when I get labs and we treat this, the numbers should be here. And as providers, if we're just looking at numbers on a page, we're doing such a disservice. There has to be questions beyond that saying, okay, how has your sleep been? How have you been doing in the afternoon where you were hitting that 2:30 slump when we talked a month ago? So, little piece of advice, if you have a provider who just cares about the numbers, turn around and walk away. That's not the best care you can be receiving, and it's a big pet peeve of mine. Guy in his 50s, we are using lower dose tirzepatide, optimizing testosterone. He's down 15 pounds in the first 2 months.
Wow.
He has some weight to lose, but he is doing an incredible job following the plan we put in place and off to a great start. All right, last one. A woman in her 50s. She's awesome. She's got a great sense of humor too. When I see her on the schedule, I'm like, this is good. We're just going to laugh. Part of the time when we're not talking shop. So we addressed her hormones, we addressed habits, including eating habits, tweaked her exercise routine a little bit, tried to increase that sleeping window because she was really just narrowing that down and not getting enough deep and REM sleep. And she told me, this is the first time I've had a good sex life with my husband in about 20 years.
Woo!
That is also another win. That one doesn't show up on the lab work.
No.
That's all I got.
Love it. So the one I'll share, and I think this was my favorite problem. There was another one, which I'll talk about too, but 47-year-old female. I don't see new patients as much. Mostly my new patients are kids because my schedule is pretty full, but she was one who got on my schedule. She waited for a long time. 47-year-old female. Her symptom questionnaire went from 48 to 28 in 4 weeks. So symptom questionnaire meaning like we do a whole questionnaire about, sleep and energy and mood, like all the things you can't really measure on labs. So that was a huge change. We really just started with testosterone. So she opted for pellet therapy. When I saw her back, her brain fog was gone, her joint pain was better, her PMDD, so kind of the moods before her cycle, hot flashes were gone, libido was much better, and her energy was much better. So it's just a simple thing that like her life's still super stressful and she has a lot going on and a lot of other things, but I'll take that 48 to 28 and then we'll keep working.
It's awesome. Well, and we call it a symptom questionnaire. We might as well call it a quality of life index.
Yeah.
The higher the number, the worse.
That's really good.
Yeah, you want the golf score. You want really low.
Okay, so last thing of the day of the podcast today is we're going to talk about our favorite supplement that we've used in the last few weeks.
I'm so glad this is the last thing. I am absolutely cooking in this vest.
It's hot in
This
here.
is like...
Okay, you want to go first?
Yeah, sure. All right. So, This is creatine monohydrate. We get questions about this every week, if not daily. And creatine is one of the most well-studied supplements on the planet, has been around for a long, long time, not only because of energy and body composition benefits, but also we're finally digging into more of the cognitive benefits in terms of short-term memory, decision-making, executive function, those types of things. So creatine is a great supplement to add in for most people. If there's significant kidney disease, we need to be careful with that. And then also nursing women, pregnant women, there's some literature out there, but it's soft, it's not great. And so I probably would steer clear in those situations, just in an abundance of safety. But beyond that, creatine is one of the best supplements on the planet, and 5 grams per day for body composition. When we start getting up toward that 10 grams per day, that's when we see more of the cognitive benefits. And that's typically what I'll take, is 9 or 10 grams a day. It comes in a powder form. This is actually a flavored version. There's strawberry, and then what's the other one?
Pineapple mango.
That one's really good. So if you just put creatine like in a protein shake, you can do a non-flavored one, totally fine. That's what we have at home. The flavored ones from Thorne that we have on the Flourish Collective are actually really good. They taste really good.
Really good.
Our Thorne rep was super smart by sending us a couple free ones here for people at the clinic to sample, and then people just started asking for it immediately.
So, I love pudding with this, like the strawberry. I like putting the lemonade flavor.
Oh, strawberry lemonade.
It's a strawberry lemonade.
It's next level.
It's really on point. It's delicious.
But creatine, a great option. It is best absorbed with a little bit of carbohydrate, and most people will put it in with like a protein shake. If there's at least a little bit of carbs in there, you'll get the optimal absorption of the creatine. 5 to 10 grams per day. There is some literature out now, especially in individuals age 60 and older, for the cognitive benefits of creatine, which is huge, especially for people with a little bit earlier cognitive decline between age 60 and 70.
Yeah. Cool. All right, my supplement pick of the month, only really because I've had several really great stories from patients and great results from patients with this in the last few weeks, and that is, there's a few here, but I'll explain why. I'll just briefly hold them up here.
She's supposed to pick one.
They are one, even though it doesn't look like it. The Parakit, okay? So Parakit means parasites. And I've had several patients who have been using this. We usually recommend and create a protocol around a full moon to help get rid of those parasites, which we could talk about more on one episode. But I've had a lot of poop pictures in the last few weeks with some pretty good results of things coming out. But my favorite, and I just saw her yesterday, teenage girl, sweetest thing. The first time she came in here, I think she barely said like 5 words to me in like our hour-long visit, and that was part of why mom and dad brought her in, was just like moods, maybe some depression, just like they just thought things were off.
Yeah.
So she's done 3 rounds of the para protocol and killed it. Like, she did so good, staying on everything and doing everything exactly like she should. She was so happy and lovely and vibrant when I saw her in clinic.
That's awesome.
Like, a totally different kid. And so that was really, really cool. We saw some parasite numbers being high on lab, which is kind of why we went that direction, but it has made a huge difference, and I could just tell. And she was so excited to be here. She does dance, and so she was telling her dance teammates on the bus to their competition on the way home about her moon bugs. And the parasite protocol. I was like, moon bugs, that's a great word. I love it.
We need to use that.
Moon bugs. So she's like, now my teammates want to come see you because they know about parasites.
Wow, and that's the thing, is especially being a teenager is not easy these days. There's a lot of stress there, but I mean, if you can get teenagers feeling good, functioning well, happy, excited, that is a big win.
Yeah, it was so cool. She's such a sweet girl. So it was fun to see her like light up and just live life more and feel less bogged down. So that was mine. So Parakit, Flourish Collective. parent kits on there. We can also walk you through how to use that. So it's fun that we now have the Flourish Collective, and you guys can go on, literally get like the best liver supplement, the best vitamin D, the best B12. So lots of companies have different things, like kind of all of them, but we've picked the best from the best, and then those are the ones that we love. So that's what it is.
Yeah, and it's nice to be able to do that, to just pick and choose a la carte the stuff that we think is the very best and not be tied to one company specifically.
Yeah.
But it's been a great month.
Yeah, that's all I have. Anything else?
I don't think so. You guys keep working on your habits here in the winter, especially when it's cold and you can't get outside. Have a plan in place. And then otherwise, God bless. We'll see you soon.
See you next month. Thanks for listening to the Flourishing Life podcast. You can watch the full video version of this podcast inside the Spotify app or on our YouTube channel. If you liked this episode, please rate, review, and subscribe on your favorite podcast app. And we would love it if you would share this episode with a friend and follow us on socials, Instagram, TikTok, YouTube, and Facebook, or on our website at flourishmedicalwellness.com. Chat soon, everyone. The information on this podcast is for educational purposes only and is not intended to replace medical advice or to be a substitute for professional medical diagnosis or treatment.